And the day will be commemorated under the theme, "It is my right to know my status. Prevention is my responsibility." Deputy President Cyril Ramaphosa is expected to attend the event in Mthatha in the Eastern Cape. Let's find out more about the event. Our reporter Zimkhita Manqinana is there for us, and she knows how the program will look like. Zimkhita, good morning to you. Talk to us about what is expected to happen today. No, it seems as if she's unable to hear us. Molo Sisi Uyandiva?
A very good morning and a warm welcome to the Eastern Cape Palace. We're coming to you live from Bumbane Great Place, where the events for commemorating the 29th celebrations of World AIDS Day are expected to start this morning with a meeting with kings and chiefs of this area. This is an attempt to try and bring them on board in their attempts of trying to fight the scourge of HIV in rural areas of South Africa. Well, Palesa, this commemoration is an attempt to try and remember those who passed on due to this virus, and also to remember those who are living with HIV and to support them at the same time. But most importantly, Palesa, this commemoration is there to highlight to those who are not yet infected with the virus on how to prevent themselves from getting infected. But before we go further, we are going to take a look at this insert that takes a look into how the Eastern Cape is affected by HIV, and also how the OR Tambo district is affected, because where we are in Mthatha is the OR Tambo district, the biggest region in the Eastern Cape, and that is where the Deputy President, who is also in his capacity as the chairperson of the South African National AIDS Council, will be talking to residents of South Africa today, addressing them on this 29th commemoration of World AIDS Day at Walter Sisulu University Stadium later today. We're expecting thousands of people to come here so that they can be educated on how to prevent themselves, and also there can be platforms to raise the issues they have with regard to issues of access to treatment, discrimination, and other relevant issues. But let's take a look at this insert before we go further.
The Eastern Cape has the third highest number of people living with HIV in South Africa. The OR Tambo region has the highest number of people infected in this province. Here, as in most parts of the country, social problems like the abuse of alcohol, unemployment, and commercial sex are fueling the spread of HIV. Gangelizwe Township in Mthatha is a HIV hotspot.
There are three main reasons why we're bringing this event here. The first reason is that OR Tambo is the highest leading district in the Eastern Cape province in terms of HIV prevalence. Secondly, OR Tambo is the NHI pilot. We want to look at progress that has been made so far in terms of the NHI project. Thirdly, we've chosen OR Tambo because this is the year of OR Tambo. We wanted, as the health and, to be specific, HIV sector, to also participate in OR Tambo celebrations, because we believe that one of his visions was to provide free health to all. And we think that that is the opportunity that the NHI is bringing forward. We think as part of this World AIDS Day heritage, we want to make sure that we give birth to a movement that will make sure that free health for all in the Eastern Cape and in South Africa becomes a reality in the next few years.
People living with HIV are appreciative of the interventions by the government and NGOs to fight the disease. They also encourage people to know their status and get treatment or continue to play safe. Traditional leaders are also on board. Partnerships with relevant stakeholders are seen as key to conquer HIV/AIDS.
Even in the Royal Palace, we need condoms. We need an HIV HCT testing center here, so that every time people come for whatever reason to the Royal Palace, they can be accessing condoms, accessing treatment, accessing testing, accessing counseling, because it's about time that we make sure that our people are making sure that they work towards eradicating AIDS as much as we're working towards eradicating poverty.
The work done to reduce the number of infections and the wide-ranging treatment campaign is paying off. According to UNAIDS, HIV infections in South Africa have since 2010 decreased by 49% and AIDS-related deaths by 29%. Zimkhita Manqinana, SABC News, Eastern Cape.